Thanks for joining us for That Larimer County Show. My name is Denny LaRue, Larimer County Community Information Manager, and this is Neil Gluckman, Assistant County Manager at Larimer County. On this show, we're going to look at human services and the people who direct them and talk about the programs provided by the Department of Human Services at Larimer County.
Yep, we're very fortunate. We have Ginny Riley and Laura Walker. Ginny's been with the county for 20 years, Laura 15. They are both co-directors, and I think we'll start out with, what does that mean? How can we have two co-directors of one department?
Well, I will be retiring after 20 years with the county in June, and Laura has been selected as the new director. But I have some opportunity to have some time to train Laura, and although she has been with the department for many years, but I have the opportunity to spend some time with her in that transition.
That's great. And Laura, you want to give us some background first, maybe about yourself and then also about human services?
Sure. So as been mentioned, I've been here for 15 years. I really came to this work in a non-traditional way. A lot of people who end up doing administration of human services type programs started out in the field. Maybe they were a caseworker or they had issued public benefits and managed cases of that nature. I came to this work through human resources, actually, and I spent 10 years, my first 10 years with the department as their human resources generalist, and then I'd had private sector human resource experience. And when I moved into the administrative role as the deputy director 5 years ago, it was really gratifying for me that that background in human resources really did prepare me well to manage people and also to manage programs. So that's really the journey that I've taken up to this point.
So, and speaking of programmings, and that's great because you both bring a background of some nonprofit experience to the table.
That's
too.
correct.
So you bring a lot to the table as co-directors. And talk about the programs that Department of Human Services provides, because our audience out there, some people will be aware of various programs, but you have a lot of programs and a lot of categories of services.
We do. And so a lot of people traditionally would think of human service, or the old term that in this industry was social services. That might be more familiar to people in the audience. But it's really not just a safety net kind of program that we offer. We really have four main categories of the services that we provide. Public assistance is probably one that would come to mind pretty quickly for people. That would be food assistance and Medicaid services for people to get health coverage, and then also cash assistance programs for people that are very little income types of families. And then we also have our child protection services, which again would probably be traditionally thought of when you think of social services. So if a child is at risk of abuse or neglect, we would intervene and try to help stabilize that family. And then we also have aging and adult services, which is going to become much more of a focus for us as our population here ages and gets to that point. And then we also have child support services that, again, people might not think of as a social service offering. In some states, it's administered in a very different way through their departments of revenue, actually, which is kind of surprising. But we offer the child support services in our department as well.
Now, are the child support services and the child protection services, they sounds like they're two really separate things.
Very much so.
Okay.
So child support would be when parents are no longer together, whether through divorce or separation of some kind. It ensures that the custodial parent, the person who has the children from that relationship, is receiving appropriate support, monetary and also health care coverage support for the children in their care.
Okay. And your adult programs, adult services, are through the Office on Aging?
That is one area where we provide a lot of supportive services, things like caregiver support for people that are caring for aging family members on their own. They also have ombudsman services, which go into the nursing home and skilled nursing facilities to make sure that the residents there are getting their needs met and advocating on their behalf. We also have adult protective services, which is not in the Office on Aging, but we'll take a look at people who are at risk of abuse or neglect, self-neglect, and those services as well.
So you have programs that have income eligibility, but you also have programs that anyone could go to.
Absolutely.
And the Office on Aging might be an example of any one of us could.
It's based upon need, not on income.
Yeah.
I have to throw out a little promotion here while we have a moment, is for the Answers on Aging guide that you put out every year. It's online and it answers so many questions in that realm. and it's full of information. It's right online called Answers on Aging.
Answers on Aging provides information for the community on various community resources available to people 60 and over.
Yeah, it's great.
And what's an easy way we could find that? Just go on to Larimer County?
www.larimer.org and go to Department of Human Services, and it's easy.
And Office on Aging, and you're there.
Okay. Good. I need to know that.
We all do. No.
We're all aging as we speak.
Yeah.
So you use the word traditional. Are your services from, let's say, put Ginny on the spot, from the day you started to, let's say, now that you're a co-director, have things changed?
The services per se have not, the array of services has not really changed. The Human Services Department's charge actually comes from many years ago in the 1930s as we came into the Depression, and the federal government took a role in assisting with people in need in communities. And so some of our services were added at that time, and some of our services were added in the 1970s from the War on Poverty, and Medicare and Medicaid came in at that time. And child protection also came in as a responsibility of ours. We are the face of the federal services and many of the state services in the local community. So we become the conduit for delivery
of the services.
Well, speaking of that, as the arm of those services, talk about your funding.
So we have a blend of different types of funding. In the most simplistic way, I think I can say that county funds through property taxes and the other revenues that the county receives funds about 20% of our total operating budget. And then we have a mix of some grants, we have state funding, we have federal funding that flows through the state office and then comes to us in the form of allocations to deliver the services.
Interesting. It's about 20%.
Yes.
Now, you mentioned some of the ways you work with different agencies changing over the years. You work a lot with the Workforce Center now.
Yes, we actually partner with the Workforce Center for delivery of the federal program Temporary Assistance for Needy Families, which came about as part of welfare reform in 1996, federal welfare reform. And they are our partner to do all of the job preparation, job assessment, job placement, and job retention services for the clients in that program.
So I'd like to talk a little bit more about collaboration. Do you guys just partner with the Workforce Center? I mean, or do you do most of your stuff alone? Tell me a little bit more about partnerships and how that works.
Partnerships are critical to what we do. And if I reflect back on when I came here 20 years ago to Larimer County, one of the things that I found was that the Department of Human Services, then Social Services, was very isolated and very insular from working with the community. And coming from a nonprofit background, it was critical to me that the community be involved in addressing the needs of the people in our own community. And we were not going to be able to be effective if we didn't involve the community. That's the private nonprofit community-based organization approach that came from my background in nonprofits. And so we have worked diligently over those 20 years to really position our agency as a partner with other community agencies, the faith community, other governments, to deliver these services in a way that is seamless and maximizes the resources available.
So Laura, are you going to continue that way of doing things, or are you going to be an isolationist and go back to the...
No, I don't think going backwards is the answer. As a matter of fact, I've seen some examples in other large county human service organizations where they've done some of this better than we have. And so I'm learning some lessons from my peers in some of the other large counties, especially in the public assistance realm rather than in the child protection realm, where I think we really have a very solid community net around the families that have to be faced with going through a child protection case with us. But I think on the public assistance side, we haven't had as much focus on the holistic self-sufficiency for individuals and families, and that's a place where I think we can really expand and do more. And so that is on my radar as I move into the role that Ginny's going to be leaving, is that's one of the focus areas for me in the first year.
You know, it makes so much sense. You were talking earlier about the Workforce Center, and you know, everybody read about the clock starting to tick on that 5-year mark. Well, that's one thing to say that you're your services will end after 5 years, but now you're stepping in to make sure that they have the assistance they need so they can get the training, to get the job, to, so at the end of 5 years, they'll be self-sustaining. I mean, it's really, those are the kinds of things. Is that a big change from the early days of?
Oh, yes.
It's huge.
The early days of so-called welfare were that people just got a check and that was that. And if you wanted some help with getting a job, we could make sure that you got referred to the right place. But what really came to light with welfare reform is that employment is going to be the road to self-sufficiency for families in our community, and that we have to provide those supports for employment that are going to help people be successful. And most people are not probably aware that very few people reach that 5 years on the assistance. Most of them are either employed or some of them relocate to other communities or whatever. But we have very few people who actually fall off that cliff with no assistance.
That's good. That's a good thing.
And that is actually improving as we come out of what we call our recession, and more jobs are available for people.
Well, in that same vein, too, with child protection services, our goal is to be a very short-term intervention with families. And we know that without some natural supports in the community and places that families can go when times get tough again, because they often do. Raising children is a very, very difficult job. I'm finding that out for myself over the last 10 years. And so, you know, making sure that the community is there for these families, because I think the old style of social services was a bit paternalistic, that we were going to just take care of everything and we were going to fix the problems and maybe fix the people. And we don't see ourselves that way anymore. We are a short-term intervention to stabilize, whether it's financially or socially within a family system, but stabilizing and then letting them go back to their lives.
And I would add to that, keeping people in their own homes, keeping children in their own homes as long as we can do that safely, and helping elderly people stay in their own homes. And we have a very robust program to provide in-home services to Medicaid clients in order to keep them in their own homes and out of nursing home placement. And that is good for our community, and that is good for
There's a lot of research about how much better people do when
Absolutely.
they have, and they're still tied into their systems. And I've heard the Red Team talk about that initial stabilization and then really relying on community agencies to help, to give a hand up to people who are just needing a little help.
So the Red Team being differential response, and we had a whole program on that.
We did on this show.
Maybe you could just give us, you know, it's a pretty innovative way of working with child protection, and so maybe you give a little snippet about that.
Differential response is started as a pilot program. It's a national best practice in child protection. And what it does is allow those low and medium risk cases that come into child protection, if the people are willing to work with us, the family is willing to work with us, it allows us to do what is called a voluntary case and work directly with them to stabilize their family, keep their children in their home or at least with kin if they have to be temporarily placed outside of their home, and does not put the specter of being what they call substantiated for child abuse or neglect. And as long as they work with us for those cases, then there's no record in the system that they were substantiated for abuse and neglect, which is really important to families. And
keeps them out of the court system, too.
Keeps them out of the court system, keeps them from going deeper into the system, and supports families in being successful.
You're both into process improvement. I think that was one of the things that you brought to the table.
Yes.
Straightening the pipes.
Yep.
Straightening the pipes.
That's my term for that.
So tell us about how you've made things a little bit more efficient, effective.
So really the main focus for process improvement up to this point has been in our benefits delivery area, the public assistance side of things. And I think it was a real culture shift for our staff, because when people first were doing this kind of work years ago in our department too, each individual person would have a caseload of so many families. And so they would manage those cases. They would do recertifications every 12 months or whatever the program required. And they felt that they got to know some of their clients pretty well and had a rapport. Well, as our caseloads increased, which they've about doubled in the last 7 years in total in those programs, the Affordable Care Act contributed greatly to that, but also the recession that, as Ginny had mentioned earlier. And so coming to a place where we realize that there's a phrase out there that we don't make widgets for people who are in a helping profession, but really when it comes down to it, the transactions that happen day to day for those public assistance cases really can be managed in a workflow rather than looking at it as case management or a lot of social intervention with families, because what they really need is that benefit when they walk out the door. They need to be able to go get food, they need to be seen by a doctor, they need to keep the lights on.
So those are instant, I mean, as fast as possible. I know that's one of the things you look at is your turnaround times for these things. So for the audience out there that doesn't have any understanding when you say caseloads doubled in the last 7 years, what are we talking? How many clients or issues does an individual work with? Or
So for the public assistance programs in total, about 7 years ago we had around 30,000 unique cases. We had 30,000 total cases in Larimer County. And it's not an unduplicated number because we would count a medical case and a food assistance case and a cash case, but they all might be people living in the same home, the same household. So we had 30,000 about 7 years ago, and we're at about 58,000 today.
Okay, so that gives a little...
Amazing.
Yes, there's a lot of people out there who have need of your services.
And you need a system that could provide that in a quick and efficient way.
And that's straightening the pipes, huh?
Yes.
You can get them.
There are a lot of people out there who need assistance, but also I think we've made some changes that have made it more comfortable for people to come in. More people are aware of what we do, and the Affordable Care Act, healthcare reform, had a lot to do with that. As people came in and applied for healthcare assistance, we would screen them for any other programs they might be eligible for. So we have actually had a great outreach to people who have been eligible potentially all along and haven't accessed services. The other influence on that has been our strong emphasis on customer service and being available and responsive and welcoming to our customers, which is a very strong culture change from the time when I came in.
Paternalistic.
Very much.
So you're not treated as a number, you're out there and you're trying to really be more caring and...
So people feel comfortable coming in to get services. What would you say is the one service that probably is the most, the one thing that people use the most? Is it food assistance? Is it housing? Is it medical?
It's medical at this point. And that is because not only the Affordable Care Act changing some things, but Colorado as a state made some decisions several years ago to expand their eligibility for certain Medicaid programs. So the state office went to the federal partners and said, we would like to open Medicaid farther, have different categories of people that previously would never have been eligible for Medicaid. And so those two things have really contributed to the rise.
In particular, single adults, adults without children. The opening for that population has led to a major increase and a major asset to our community in enabling people who don't have children to actually become eligible if they are income eligible.
Big change. So speaking of changes, then where is everything going? Where are we headed?
So when you look at the performance measures that we use to gauge how we're doing, we are bumping up against excellent performance in every program that we have. Our state office frequently is in touch with us to find out best practices of what we're doing so that they can be replicated in other locations. And so for me, I would like to maintain that performance, still keep striving for maybe that last 1% or 2% that we're short maybe, but I'd really like to focus on our staff and looking more at staff development, trying to address our turnover issue, which is the worst in our child protection group. It's a very high-stress job. It has a large potential for burnout, vicarious trauma, some of these issues. We do better than the national average here in Larimer County with our child protection caseworker turnover, but we have room to grow there. And so looking at how we can help people be more resilient in doing this work, how they can make sure that they're taking care of themselves and maybe get a little more longevity and a little more tenure for our staff.
When you listen to those
That's
cases,
great.
to be more resilient, like to hear that, I would think would be very difficult because these are hard cases that they have to listen to day after day,
and I think we rely a lot upon the successes that we have.
Yeah.
We're trying to be more diligent about finding the success stories and really proliferating those amongst the staff because that's what makes the difficult work worth it.
right.
We're also looking at how we can support our staff
Right.
and hire the right staff because this is a difficult job and it doesn't benefit a new employee or the department if it's not a good fit for them.
Yeah.
So we have done some really good work on trying to make sure people basically know what they're getting into, what the job is really like, and trying to fit the personality and the
I know
experience.
it's a systemic problem, and like sticking with it because the outcome is going to be worth it, possibly. I mean, really possibly.
Right.
Well, we have about 4 minutes left. Time really flies, and we want to make sure to cover everything that is important for people to know. We do want to also mention that, Jenny, you were just honored last April for Women of Distinction in the Government category by BizWest Media.
Thank you. It was very touching. We don't do this work for the accolades, but when you have them, particularly as you're looking at heading into retirement, is very special. And I couldn't do this work without the good people that work with and for me. So
And to be recognized by your colleagues and your...
to be recognized by your colleagues is really special.
Yeah. And I know that when we put out our community report annually, we're always looking at the statistics, the performance measures that you folks do because they're so interesting and you do so well in so many areas that it is a real bonus to the county how well you do and how high those percentages are. It's very good. Yeah, it's a good for the rest of the state to look up to as well.
Yes.
Having good performance is important.
Yes.
In terms of meeting our funding requirements and our regulatory requirements. But the important thing is that that good performance is always related to good outcomes for the people that we serve. And so we don't have any difficulty with getting commitment from our employees to those outcomes because they are not just numbers. They are people.
They're people.
You're changing the community for the better. And I think that people are really touched and understand that. So, any closing remarks?
Any closing remarks from you two?
I would just like to take this opportunity publicly to say how much I've appreciated Ginny's leadership these past 15 years, and I believe that she's prepared me very well to fill her shoes, although they're very big shoes to be filling in the next month.
And we'll have to test that out.
Yes.
Yes.
We'll have a shoe try on.
Yeah.
Yeah, there you
I
go.
will redo a probationary period in this position, so there's time for evaluation.
And you'll have a new deputy director also you'll be announcing here in the future.
Yes.
Coming on board, so you'll fill that position. How many people work for the Department of Human Services at Larimer County?
About 370.
It's one of the...
Is it the largest, the second largest?
Personnel-wise, it is the largest.
The largest. And the sheriff's office is
The
next?
sheriff's office has about 355, I believe, at this
Okay.
point. But
Yeah, so it's a huge area. Yeah, so many programs.
And all 300 and plus report to one of the co-directors, right? Just one
Yes.
person.
Oh, yes. We can't even keep track of them.
Right. Part of that process improvement.
There you go.
We want to thank you so much for being on the show today.
Thank you.
And if people have questions about your services or want to know more, they can just go to the website at larimer.org, click on Department of Human Services, and I've been to the site many, many, many times. It's very user-friendly and easy to find things. So.
And there are links on that website for emailing us if people prefer to use that method.
Okay.
Great, great.
All right.
So there's always a way to contact you or get more information.
Yes.
Neil, anything to add?
You know, I think there's an abundance of information.
I
so
know. It's true.
More than we can cover in so short a time, but there is a lot out there.
And as usual, we don't know what our next topic is yet.
No.
It'll be wonderful and surprising, but we don't know what it is yet. So we want to say thank you very much for joining us on That Larimer County Show and staying tuned. Thank you.